I'm going to show you a nice case. This is really largely directed towards the first year residents in pathology and dermatology. And it's another case shared with me by Antonina. And it's quite an educational case because we can see quite a few features in it. Now, I, I don't have the clinical information, unfortunately, but I think I can probably make up something that would be a reasonable approximation. So let's say, for the sake of argument, that this is a young adult, say a patient in their 30s, and with this thick dermis, I think it's probably from the back. And we'll say it's a female just for argument's sake. So, with that in mind, um, one just has to wonder how this might have presented clinically, because generally, when a physician or a dermatologist excises a lesion in toto, as you see in this case, with a wide margin of uninvolved skin, it usually indicates that there was something worrying the clinician or perhaps the patient as well. Now, what we can tell is there's a, 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 a lesion on this side and a little bit left on that side, and then we've got this sort of noduly thing sticking out from the side. So what I would have imagined is that the patient would have presented with a warty lesion with a hyperpigmented part at one edge of it, so that I suppose the clinician would obviously have been worrying, is this melanoma perhaps arising in a background of a nevus? So let's look at this at higher power and see what information we can get. Now, because I think this is particularly directed to the younger folk, I just want to look at the nevus population to establish some sort of ground rules. If you remember, in nevi, the junctional component and the very superficial dermal component consists of type A nevus cells. And type A nevus cells have identifiable, sometimes abundant cytoplasm and round to oval vesicular nuclei with small nucleoli. Now, these are typical type A nevus cells. You can see the cytoplasm, you can see the nuclei, you can occasionally pick up a nucleolus. So these are the type A nevus cells. And as we move down the lesion towards the deeper aspect, you can see that although there are still scattered type A nevus cells, mostly the nevus is replaced with hyperchromatic blue cells with minimal or no obvious cytoplasm. These are the type B nevus cells. And if we go down to the base of the lesion, you can start seeing a spindle cell component, and these are the type C nevus cells. So that's been quite useful as a little bit of an educational lesson on nevus cell types. But you will notice even at the depth of the lesion, one can pick up type A nevus cells. But the predominance is type A at the top, type B in the middle, and type C in the deep aspect. So let's go back to the lesion and let's have a look at this bit. Now, the thing that strikes me first of all are these ectatic vessels, stuffed full of red cells. So that would have given a clinical appearance of variable coloration. If we look here, we can see there's melanin pigment, so that would have appeared brown. But then we've got these blood vessels which should have appeared pink or red. So we have already brown coloration, which would have been irregular. So there's good reason that the clinician might have worried about this lesion. Now, I'm just going to scroll down from the top to the bottom, and I think you can notice there's a very variable appearance within this central nodule. At the top, it's composed, let's go to higher power, it's composed mostly of type B nevus cells. So they're hyperchromatic, they're blue cells. There are scattered type A cells here and there, but I think the blue cells are predominant. There's some type A nevus cells, just by way of pointing them out to you. They're scattered throughout. But as we go deeper down, the cell population becomes much more type B. We also notice there's some scar tissue, and we can also see lots of melanin pigment. Now, some of the pigments clearly in macrophages. We'll magnify this to times 40. See, this sort of cell is a macrophage, and so is that, and so is that and that. So there are pigment-laden macrophages, but on top of that, there are these spindle cells stuffed full of pigment, and some of them show dendritic processes. And so you might begin to wonder, is there a blue nevus component in this? Or are all these spindled macrophages? I'm inclined to think that there may well be a blue nevus component. There's a sort of a dendritic cell there, and they're sort of scattered around. You can pick up that there's a mixture of pigmented cells, and so this then brings me to trying to make a decision as to what I think this is. Now I have two options, and I'll go back to times 2 to consider them. The two options that I'm thinking about are, one is a combined nevus with largely banal nevus at the top and a common blue nevus component at the bottom. I think that's a reasonable diagnostic option. The alternative that I can think of is an inverted type A or clonal nevus, and that's a reasonable suggestion. But I don't think that really accounts for all of these, what I think are dendritic cells. So my personal diagnosis would be more in keeping with a combined nevus. But I'd be interested to know what you all think, and perhaps on this case it would be really nice if you could add a comment to say which you think it is, or whether you have a third option or a fourth option. That would be quite good fun, and I think it would add to the educational value of these videos if we got some commenting. The other thing I wanted to ask you is a favor, and that is, if you like the videos, please click on the like, because it matters quite a lot to me. And also, if you haven't subscribed but you would like to see more videos, please subscribe to my channel. And again, that is very helpful to me. So I hope you've enjoyed this case, and I'm looking forward to hearing what you have to say. Thank you very much.